Hello guys, this is Mel here from Diabetes Primer, and I thought I'd just do a quick little information video for you on diabetes and COVID-19. And I just want to share information from an article that I've read in the Lancet journal, which is a medical journal on diabetes, and it just essentially covers a lot of areas. I'm not going to be able to cover everything that they discuss in the video. So there's this perception in the media that people living with diabetes are more at risk of developing COVID-19. But the research that is coming out of China, and remember, the oldest data that we have available on COVID-19 is from China, has shown that the percentage of people who have COVID-19 who are diabetics, right, is on par with the percentage of people who are diabetics in the general population. So, for example, and I'm going to have to look at the numbers on my piece of paper. So, for example, from memory, because I didn't write it down, 9.5% of people who develop COVID-19 in China also have diabetes. However, of the total Chinese population, the population that has nothing to do with COVID-19, about 10% of that population have diabetes. People who are living with type 2 diabetes are more likely to be represented in that 9.2% that we talked about than people who are living with type 1 diabetes. And I'm going to talk about that because when you look at people who have got type 2 diabetes, they come with a whole lot of other comorbidities, right? It's a very, very different disease from type 1 diabetes. Type 1 diabetes is an autoimmune disease. Type 2 diabetes is more a metabolic syndrome. So type 2 diabetes, we know it as a disease that is about high blood sugar levels, and it certainly is that, but there are more to it, right? There are an inflammatory component. So the inflammatory markers in type 2 people living with type 2 diabetes is not like a person who doesn't have diabetes. And then also there's an anticoagulant component. And you all know about aspirin and IR, and you have to press down a bit longer because you're more likely to bleed. When I'm talking about an anticoagulant cascade in diabetes, I'm talking about those things like you're more likely to bleed. Some people are on warfarin, and so I'm not saying that type 2 diabetics are on warfarin. I'm saying with this anticoagulants, I'm trying to steer you to what I'm talking about. And then you know all about the neuropathy and the nerve damage in diabetes, which is part of this whole high glucose levels in the blood vessels. But at the other end, coming with type 2 diabetes is also high blood pressure and heart disease, right? Cardiovascular disease in medical parlance, and obesity. So people who are living with type 2 diabetes are more likely to have high blood pressure, cardiovascular disease, and to be carrying extra weight. In fact, people are often diagnosed with type 2 diabetes when they have like maybe a heart attack. That's probably one of the most prevalent times when people get diagnosed. My father was diagnosed when he had a heart attack. And often people go to the hospital for something completely different, and then they discover that they've got type 2 diabetes. So in that landscape, in that clinical environment, for a lack of a better term, with all of those things going on in our bodies when we've got type 2 diabetes, when we get COVID-19, Corona SARS-2, we get it at a more severe level than people who do not have diabetes, right? Because our body's already dealing with a lot. It's already fighting off a lot of other things, high blood pressure. We're on medication for that. We're more at risk for coagulopathies. We're carrying extra weight, so which means we've got a lot of fat around our liver and in our belly. So when we get coronavirus, we are going to be more sicker as diabetes, people living with diabetes. We are more likely to have a more severe pneumonia, and we are more likely to end up in ICU with coronavirus. So with this higher risk of comorbidities, people living with diabetes has got a propensity to be taking a lot of other supplements to help lower their blood sugar levels, like cinnamon or holy basil or ginseng or aloe vera. And we are also taking our metformin, our sulfonylureas, our insulin, all of those things. So all of these medications interact with each other, right? Because they're all clear. 70% of prescribed meds are cleared by the liver. So if you are adding in anything else for COVID-19, because we are all doing that, we're all taking zinc and we're taking lots of things, herbs that is prescribed in different parts of the world to help fight off COVID-19, remember that those herbs and medications are going to interact with your oral hypoglycemic medication, right? The other thing that has been very topical in the news is hydrochloroquine. People are taking that, and there is absolutely zero scientific evidence that this medication is effective effective for SARS coronavirus 2. I had a look, and I've been hearing this for months on the news, and I've actually read some scientific papers because people have gone away and done research, right? We all want to find a cure for COVID-19, and there are no evidence. There is no cure. But what they have found is that hydrochloroquine can interact with your medication, your insulin, your sulfonylureas, and your metformin, those type of oral hypoglycemic agents, to further lower your blood sugar levels, which could lead to you having a hypoglycemic attack. So be mindful and just give it some serious thought as to what you're going to add into your arsenal against COVID-19. The other thing that I wanted to just quickly cover is that if you start feeling unwell as a person living with diabetes, increase your blood sugar monitoring to 2 hours to keep an eye on it. Please ring a friend to tell them that you're feeling sick. So let somebody know, especially if you're living alone. Let someone know that you are feeling unwell and that you've increased your blood sugar levels, you've increased your oral fluid intake, and that you've activated your sick plan. So remember, when you start feeling unwell as a diabetic, whether you have COVID-19 or not, you have a sick plan in place for days when you are starting to feel off. So please activate that. And if your blood sugar level starts heading up to 15 millimoles or 217 milligrams per deciliter, I would start heading to the ER. Don't stay home until it's the last minute. Go out and get help. The people who have got a higher incidence of having extreme reaction to COVID-19 are people who are living with high blood pressure. And in this article, that I have read in the Lancet, and I'm going to post that article, a link to it, in the Facebook group. So for all of you who want to have a closer look at the article, there's a whole lot of information in there, excellent data that I can't cover in here. And, you know, so therefore, if you're a nurse or you want to know a little bit more, click on the link and read the article, because I talk about why people with high blood pressure get sicker with COVID-19, and they talk about things like the ACE inhibitors, which a lot of people are on for as an anti-blood pressure medication, antihypertensive, and how ACE inhibitor 2 carries the SARS coronavirus into the cells, and apparently you find it on the kidney cells, the brain cells, the ileum, the heart. Is just everywhere, and that is what's carrying this coronavirus into the cells of people who are taking these medications. They cover a lot of other aspects of this whole COVID and how it gets around the human body. They talk about the inflammatory markers. They talk about the fat, the obesity, that fat in your body, fat around your liver. So if you want to have a closer look, please click on the link in the Facebook group to the article. And if you're at home and you're living with diabetes, remember, please, if you start feeling sick, activate your sick plan. Call someone to say that you're not feeling well. If you start getting to 270 milligrams per deciliter or 15 millimoles per liter, or even before that, depending on how you feel, it's time to head to the ER. Keep yourself well. Control your blood sugar level tightly before you get to that range, before you get to your sick days, so you can stave off getting sick. Wear your mask in public. I don't have to tell you that. You know that you should be wearing a mask when you go outside. Watch your carb intake. Keep your carb intake on the lower side so that you're not eating in all that glucose and pushing up your blood sugar level. And exercise so that you can burn off some of those glucose that you have taken, orally eaten, that potatoes that we shouldn't be eating, but we all love on a Sunday at lunch. It's a good time to go for a walk. You can walk with your mask on. It's certainly very easy to walk around the lake or walk around your neighborhood with your mask on. That's not too difficult. Please, guys, look after yourself, look after each other, and stay safe.